Today, we are delighted to welcome Dr. Pradnya Badge with us. She has 2 decades of experience in obstetrics and gynecology. With her clinical knowledge, she has empowered over thousands of women with compassion and comprehensive care. Welcome to the show, Dr. Pradnya
Thank you,
Badge.
Alicia, and thank you, Jivika Foundation, to invite me here for this topic discussion.
Thank you so much. Today we will be talking about the most deadliest cancer among the women in India. Those are breast cancer and cervical cancer. So, as breast cancer and cervical cancer are most deadliest cancer in India among the women, can you help our listener understand the difference between these two cancer and why awareness is important about these cancers?
Yes, Alicia, I would like to differentiate between the breast cancer and cancer of the cervix. These are the most common cause of the cancer in the Indian women's. Breast cancer is a cancer of a breast tissue, and cervical cancer is a cancer of the cervix, that is a part of the uterus, that is reproductive system of the female. So breast cancer is usually highly treatable, but cervical cancer is preventable, treatable, and curable.
Okay, thank you. So, why it is important to do awareness about this both two cancers?
As I said, both cancers are treatable. So early diagnosis gives us simpler treatment, uh, good outcome, and highly susceptibility rate.
Okay, so as you mentioned that both cancers are preventable and treatable. So, what are the early warning signs of breast cancer and cervical cancer that women should never ignore?
Early warning signs of the breast cancer, I'll enumerate that. If there is a female of 20 years should start self breast examination from the age of 20, because early examination gives early detection of the breast cancer or breast tumor. For that, you have to see any tumor, change in the shape of the breast, change in the size of the breast, nipple discharge, nipple retraction, any swelling or pain in the breast or nipple. For the cervical cancer, we should see for the any white discharge or false smelling discharge, bleeding in between the menses, and pain during intercourse.
Okay, so it is recommended to screen early for the women's in India so that they can detect if there are any chances of cancers early and start the treatment early.
Yes. Early detection gives early treatment and survival rate more.
Okay, so as we are talking about screening, can you name the screening tests which we should do or recommend to the women's in India for cervical and breast cancer?
For breast cancer, self breast examination is the best. From the age of 20 years, after the 40 years, we should go to the clinician to do the breast examination, mammography, and in case needed, the further examination if there is a strong family history.
So, can you elaborate about the further examinations?
Like mammography, and do the genetic study also in case of the immediate relatives cancer's history.
Okay, so in as you said about the self breast examination in cervical cancer, can you explain about HPV DNA and VIA test for which we do for cervical cancer screening?
Yes, we can do the test and we can do the pap smear. In that, we will come to know the changes in the tissue of the cervix.
So, is it like I have seen many women who hesitate to do this test. So, what are your opinions about this? Because there are many male doctors also, they do not go to them, or even if there are female doctors, they hesitate to tell about these symptoms. So, what are your opinions about these things?
Female should not fear about the investigations of the tissues, because it usually gives a presentation after certain stages, in the second stage or third stage. You have to diagnose precancerous stage and first stage of the cancer for the better treatment and higher survival rate. So you should go for the annual examination like liquid based cytology, pap smear.
Okay. And apart from screening, what lifestyle choices should women make today to reduce the risk of developing breast or cervical cancer?
Good. There is a major role of a lifestyle in case for the prevention of the both cancers. For it should, there should be a maintenance of weight according to your height. Diet should be high in the fruits, vegetables and whole grains. You should do the regular exercise. We should limit our alcohol intake. No tobacco intake should be there. And for the cervical, specifically for the cervical cancer, there should not be a multiple sexual partners. Too early sexual exposure should not be there. And for both, we should do the screening test, not to hesitate to give history or any complaints about yourself in family or to a doctor, physician. And also we should go through the camps and campaigns which are conducted by our government. We should do our test regularly.
Okay. So, fear, stigma, and embarrassment often prevent women from discussing intimate health concerns. How can families and society create an environment where women feel comfortable seeking help early?
We should give a respect to a female in each and every, like mother, sister, daughter, should talk with them about their health. Should aware of their health. They are frank enough to tell about their health issues, and we should visit doctor as early as possible and diagnose it. In the society, we should keep a camps like in case of Ganpati, and common functions are there. At that time, we should have a camp for the females' health awareness.
Okay, and also we have seen that women are very busy in their families and their house chorus, so they don't get the time to go to the doctor, screen themselves, or even if they get time, they feel that their health is not important or their health is not the priority thing. They always think about their family first. So, what you want to tell to these women?
A message to each and every female listening here: your strength is your health. Your health is very important. You should go to for the investigations in regularly, and don't let fear to do investigation if there is in case of the diagnosis, as early diagnosis survives the life.
Okay. In your experience, what are the biggest misconceptions women have about breast and cervical cancer, and how would you like to clarify them?
In my practice, I usually go through the many females. When I ask them to do the investigation, they tell, no, 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 we don't have any family history. We don't have such a cancers in our family. But I saw many females having first time breast carcinoma or cervical carcinoma in their family. And secondly, when cancer is there, patient thought it's a cancer means death. No, it's not like that. After a complete treatment, you can have a lifelong life expectancy long. Thirdly, when there is a cancer, they thought that it must be a painful, but mostly some cancers are not painful. And fourthly, that they thought that it's a stigma. But many famous personality like Sonali Bendre have a cancer. They are get survived from the cancer and living a life like heroes, heroines.
So I want to ask if, like, if someone get cancer, she gets screened, she gets treated, and she is fine now. And after few years, the cancer relapse. So it becomes so woman thinks that if it is getting again, then why should we get treated at first? The money is getting wasted, health is getting wasted, the mindset has changed a lot. So what do you think and what do you want to say about these things?
It's not like that. If there is some problem, we fight with that. So it's like that only. It's an accidental sort of thing which happens with us. So we have to fight it back. Our expectancy should be prolonged life expectancy, as you are the person on whom a whole family is depend. So you should be take care of yourself, and you should be treated as early as possible.
Okay. Also, government, as we said before, that government is running some screening camps in rural areas. Also, in very they are going to PHCs and sub centers and awareing people about cervical cancer and breast cancer. Also, some women are there who go and screen themselves. They get detected and they go to hospitals for further treatment. Once the treatment is done, they stop there and they do not go beyond that. So the treatment discontinues, and then there is no use of the treatment. Also, in this case, family suffers. They themselves also suffer, but the family also suffers. There, their children might suffer, their husband might suffer. So what do you want to say to those women who discontinue their treatment?
Regular follow-up should be there. After a cure of the cancer, there should be a regular treatment or regular follow for the relapses or any metastasis at the other side of the body.
Okay. And what is the last thing you want to tell to the women of India, to each woman of India?
Take care of yourselves. You are the person who has a major role in the family. So first priority should be your health and take care of it.
Thank you so much, Dr. Pradnya. It was very nice talking with you. Thank you.